4 people have been diagnosed with potential melioidosis infections in North Queensland as the clean-up continues after heavy rain and floods. Health authorities say all 4 of the people affected had been exposed to mud or recent floodwaters and are urging people to take caution as the clean-up continues. Steven Donohue is the Mackay Public Health Director and he joins us now. Steven Donohue, welcome. So what is melioidosis?
Melioidosis is caused by a bacteria that lives in the soil, and it's normally minding its own business. But these germs can come up to the surface with heavy rain or flooding. That contaminated mud, if it gets into even minor wounds or scratches, or even droplets that are inhaled, it can cause a severe infection, often things like septicemia, and puts people in hospital. A relatively high mortality rate of up to 20%, even with the best care. So there's a lot of concern about this disease. Of course, it's not the only germ that we call opportunistic, meaning that it takes advantage of older and sicker people who may have some problem with their immune system. So diabetes, heavy alcohol usage, other chronic heart, lung, kidney diseases. They're the sorts of people, and of course elderly, who can come down with this infection. So we've been putting out alerts and also messages to the doctors and hospitals of what to look for. It can be treated with antibiotics. We can detect it with testing. But yeah, it's just an example of the very severe infections when older people are not necessarily taking basic precautions around, wandering around in mud with bare feet is just not on when you're elderly and sick. This is one of the things that can happen.
Yeah, I grew up in North Queensland and I hadn't come across this before hearing it over the last kind of 10 or 20 years or so. Has it been something that awareness of it has grown recently, or have the number of cases actually increased significantly?
Probably a bit of both. I think we are getting better at diagnosing it early, but possibly many years ago, a lot of people were dying and maybe the reason wasn't known.
Yeah.
The other strange thing about melioidosis is that it's very focal, only certain areas. And, people are saying, well, is it the geology? Is it something about the soil in that area? But more likely it's about peri-urban areas where a lot of people who are elderly, retirees, beachside hamlets, where people are moving in, and often there's earthworks or renovations. There's a picture there of somebody using a high pressure hose to clean up the mud. All of those sorts of things are risks if you've got underlying diseases or anything wrong with your immune system like chemotherapy. That means that this normally pretty harmless germ would be able to take advantage. So that's why we're giving all of those messages out there saying, take care. If there's a big cleanup going on and you're really medically fragile, your job is to make the sandwiches, not to get mud all over you. You know what I mean?
And there are plenty of good people who do that in North Queensland. So where have the latest cases come up and how are the people doing? Are they all in hospital?
Yeah, it's very interesting. The recent 4 cases, in fact 5 that we've had in the Mackay area, are all in hospital getting intravenous antibiotics. Last wet season was a record in the northern suburbs, the beachside suburbs of Townsville, and further up the coast in the southern suburbs of Cairns, where there's been a lot of road building on the Bruce Highway. So that combination of heavy rains, soil disturbance, and then older, sicker people who aren't necessarily doing the things your mother would have told you about how to manage minor wounds. Put on some boots, wear gloves, and if you've got a scratch, even a minor scratch, don't get it contaminated with mud. Wash it carefully, put on an antiseptic and a waterproof bandage, and if it's looking angry, get straight to your doctor.
Yeah, and so what are the symptoms that people should look out for?
Well, beyond a potential wound infection, people can come down with a fever. They'll feel very unwell. They might have nausea, vomiting, headaches, feeling confused. Some people collapse, and whatever their underlying disease, heart, kidney, lung disease, that will immediately go out of control as well. So these are generally quite sick people by the time they're picked up, and that's why they need care in a hospital.
Yeah, okay. Steven Donohue, thanks so much for talking to us from North Queensland.
Thank you.